Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Medical experts in Edo State advise adherence to non-pharmaceutical interventions during the holiday season. Kaduna government called for more residents to get vaccinated to increase immunity levels and reduce risk of severe illness. And travel chaos spills into new week as more than 1,000 flights are scrapped as of today. Thank you for joining us. The Nigeria Center for Disease Control, NCDC, reported over 1,500 new infections last night, another high as the country's daily COVID-19 cases continue to rise. Giving an update on the pandemic, the agency reveals that the new cases were confirmed in 9 states and the Federal Capital Territory. The data from the NCDC also shows that a total of 8 deaths were recorded on Sunday, raising the death toll to 3,022. Here's more on the pandemic update.
1,587 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states and the FCT. That's a drop from the figures reported earlier. The FCT accounted for the highest number of cases with 806 positive samples, Lagos 401, Borno 166, Oyo 78, Ogun 47, while Osun registered 30 cases. Other states, including Ekiti, Katsina, Kano, and Jigawa, logged a single-digit infection. The total confirmed cases in Nigeria now stands at 237,561. The report also includes a backlog of confirmed cases, discharges, deaths, and 0 cases from Bauchi, Ondo, Plateau, Rivers, and Sokoto states. 193 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 212,550. There were 8 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,022. Currently, there are over 21,000 active cases in Nigeria, while over 3.7 million samples have been tested so far. More than 9.6 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4.3 million persons have been fully vaccinated. In Africa, over 9.3 million persons have tested positive, while over 226,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 279 million, while deaths are beyond 5.3 million.
And a medical expert in Edo State has advised that people own the process of keeping themselves and others safe from COVID-19 during the holiday period. The COVID-19 incident manager at Edo State, Dr. Andrew Obi, emphasized the importance of adhering to the non-pharmaceutical precautionary measures of hand washing, the use of the face mask, physical distancing, irrespective of the vaccination status amid the rise in cases recorded in the past few weeks. Meanwhile, observing a mix of merrymakers in the city, our correspondent Jessica Lugboshere reports on the different levels of compliance.
Shopping for foodstuff and livestock was part of the preparations for the Christmas celebration. With the COVID-19 virus still around and the recently detected Omicron variants joining the list of strains, the advice from the COVID-19 incident manager in Edo State was for the lessons on precaution taught in the past months to be utilized.
People must own the process. People must learn to take responsibility of their actions. And one of the easiest ways is to see what you can do as an individual, groups or community, in not only staying safe, but also encouraging other people to stay safe. And one of the easiest ways is what I'm doing. I'm putting on my face mask. The non-pharmaceutical interventions are very, very important.
He also has some suggestions.
We should be able to strengthen our capacity for genomic sequencing. Sequencing will help you tell what strain, we're looking at the behavior. The behavior, based on what we are seeing, is different from Delta. But as scientists, we need to have evidence to substantiate that claim, because it could be subjective. And so the only way we can be able to do that is that if we have evidence, and genomic sequencing will provide that evidence.
With the holidays providing an opportunity for people to spend time with their loved ones far and near, this transport line, plying routes within Edo State, was not bereft of passengers a day before Christmas. The manager maintained the company was doing its part in the area of enlightenment about COVID-19, just as the passengers shared his views.
So yeah, we do talk to them. See, this is still day on. Put your face mask. We have a wash your hand, busy there, wash your hand.
I have this fever right now. I can't wear my nose mask, but I have it with me. So that is one of the, I'm following all the precautions they actually applying.
It's a similar situation at this other park, where the journey is longer, with the vehicles headed outside the state.
We told them, although some of them don't comply, that they must put on face masks before they enter the vehicle. We tried and tried. Most of them will argue with us, no face mask, no coronavirus in Nigeria. We even told them the new outbreak. Now, they refuse to buy.
And on Christmas morning in church, there's a mix of COVID-19 precautions measures compliance during this mass. Face mask sellers got the chance to make money as the fun times continued on Sunday, Boxing Day. The Ogba Zoo and Nature Park was the venue some residents and visitors chose for entertainment and relaxation. Even though outdoors, the use of face mask was required.
The face mask is very compulsory. I'm still using this medium to tell everybody, especially people in Edo State, to always follow the rules and regulations being placed by the Edo State governor to ensure that this COVID-19 doesn't spread beyond control.
It's the regulation. You cannot enter here without face mask. So they say it's a regulation. This is a way. So before coming, you must have face mask before you enter. So that's why I buy.
As the good times roll on and even beyond then, the advice from experts and relevant authorities is that individuals have great power to keep themselves and others protected from COVID-19, and it's in doing the little things. Jessica Olubuser, Channels Television News.
And it's still a call to take collective responsibility to reduce transmission of the COVID-19 virus. Dr. Safia Ojo is a family physician, and she joins us on the program for more on staying safe this festive season. Welcome to the program and happy holidays.
Thanks for having me, Millicent. Good evening, Nigerians.
Now, Dr. Joe, you heard the comments from, our last report, some people saying, there is no coronavirus outbreak in Nigeria. I mean, is it a different COVID-19 in Nigeria, Africa, from what we're seeing in the rest of the world?
Well, COVID-19 exists. It's an ongoing pandemic, which has resulted into large death toll all over the country. And we know there are different variants, there are strains, new strains coming up. Now we have the Omicron, apart from the Delta strain. So it's everywhere. So I know a lot of people don't believe this, and that's why some people still live very careless. Whatever the strain is, COVID-19, we need to protect ourselves from COVID-19. Either is the Delta strain, the Omicron, or whatever strain, we need to go back to use of face masks and hand washing, and also try to distance ourselves from others, especially when you're in a crowded environment. So I think we need to do more. A lot of people they've stopped wearing their face masks. In fact, when you go for an occasion now and you wear your face mask, they see you as an outcast. They see you as, where is this person coming from? People no longer use it. Some put it in their pockets. Nowadays, you go to parks, it's loaded with passengers. Nobody is wearing face masks. Whatever the strain, I think we need to go back to our drawing board. We need to do the needful. We need to go back to washing of our hands with soap and water, use of face masks, and use of alcohol-based hand sanitizers. I think that will help a lot in reducing the spread of COVID-19 in the community at large.
Let's look at the FCT, which recorded about the highest cases last night at 806. Do you think we've started seeing community spread of the Omicron variant yet?
Well, when you talk about community spread, when you a community spread means you having a large number of individuals coming down with the virus without traceable. You can't trace where it's coming from. You can't trace any history of, there is no history of travel, there is no history of contact with infected individuals. So it's a possibility. So we need to work more in campaigning against how to prevent COVID-19, so everybody will know what to do to prevent transmission of COVID-19 to others. Especially people that are sick, when they have fever, they should go to the hospital. Don't have fever and go attending parties or go to churches or mosques when you know you are feeling sick. So people should try to get treated when they have symptoms of COVID. And also, I think it's better we keep talking about it. A lot of campaign is needed so that people can be aware of this. The virus exists. People should try and protect themselves and protect their family members from acquiring, from contracting the disease.
So essentially, that collective personal responsibility in this area. Now, the message is also to avoid all non-essential travel within and outside Nigeria, and also that the virus that causes COVID-19 is more likely to spread in mass gatherings, especially when they're held indoors with full capacity or poor ventilation. Explain to us why outdoor events are actually much better.
Okay, outdoor events are much better when we're talking about spread of viruses generally, unlike staying indoors, especially when it's a large gathering. It reduces the risk of spread when events are outdoor. So I think even when trying to hold indoor events, it should be well ventilated. The windows should be widely open so that there should be a good ventilation to prevent spread from one individual to the other. So I would advise that many people should do more of outdoor gathering than indoors to reduce spread of COVID, because the virus is less, there's a less spread when outdoor compared to indoor.
The Nigeria Center for Disease Control, in its recent message, Yuletide campaign, is calling for religious leaders, head of institutions, organizations, businesses to also enforce the public compliance to COVID-19 preventive measures in their jurisdiction. But we also know that some religious leaders do not practice the NPIs or believe in it. What do we do in that case?
It's a terrible, serious condition, because when people don't believe in something, they don't even believe it exists. So they won't want to prevent it. They don't even, they think it's not in existence. So why prevent what is not in existence? So I think that has a very negative role to play, talking about the fight against COVID-19, because when you don't believe in it, you are more careless. You don't wash your hands, you don't use your face mask, and you go to gatherings even without use of your face mask. So it's more of a problem when we have leaders that don't even believe in COVID-19. Despite all the news, you hear people dying here and there in different countries, different variants, strains coming up. So I think a lot of role can be played by our leaders, either in churches, mosques, and other places. So they will help to enlighten the people on existence of COVID-19 and how to prevent it. But if they are not even aware or they don't believe it exists, I think it's a major problem that we need to deal with.
Dr. Safia Joe is a family physician joining us from Abuja. Thank you so much for joining us on the program, and happy holidays.
Thank you so much too. You're welcome.
Well, still to come on the program, Kaduna government is urging residents, religious centers to adhere to the COVID-19 restrictions. We'll have that story and more when we return. Welcome back. Over 100 youths who participated in the just concluded orientation of the second phase of the Delta State Rural Youth Skill Acquisition Program have tested positive for COVID-19. The State Commissioner for Health, Dr. Modi Onoye, disclosed this in a press briefing in Asaba, where he also advocated for a holistic approach for critical stakeholders to stemming the spread of the pandemic through sensitizing the populace on the need to get vaccinated and strict adherence to all the COVID protocols.
And relevance for its beneficiaries. Over a week ago, over 700 youth were inducted into the Delta State Rural Youth Skill Acquisition Program, RYSA, at the NYSC camp in Iselu, Aniocha South local government area of Delta State. Unfortunately, over 100 of them contracted the coronavirus despite efforts to ensure that non-pharmaceutical measures were adhered to. The State Commissioner gives an update of the situation at this briefing. Although most were asymptomatic, he assures that contact tracing is ongoing and the situation is being monitored.
Not long ago, there was a gathering in the youth camp at Iseluku, where we had over 750 youths gathered, and about 117 of those youths tested positive, which was quite a high ratio. But of all those that tested positive, majority of them were asymptomatic, as they had no symptoms, and those that had symptoms were also mild symptoms.
The state government says the turnout of residents at the vaccination centers has not been impressive. They used the opportunity to highlight strategies it has now adopted to achieve a reasonable percentage of vaccination for its eligible population.
So the strategies are fixed posts, outreach, where we move outside the health facility to the communities to vaccinate. That's the outreach strategy. Then we have mass vaccination sites.
They also hope to do more to enforce compliance in public spaces.
We're having meetings, and we're doing already, and we're having one this morning with club owners. We know that people that are coming to Asaba now, they're really coming to enjoy themselves in crowded, in clubs that are airtight. We don't use air conditioners. They're investing here. We do not want to discourage investors, but we also want them to observe healthy practices in the clubs and organizations that they carry out.
Although the state is yet to record any death on account of the fast-spreading Omicron variant, residents have been advised to get vaccinated to help reduce the severity of the virus when one contracts the virus.
Well, the message is no different in Kaduna State, where the Ministry of Health has advised residents of the state, churches, recreational centres, other public places to always adhere to the stipulated guidelines during the celebration. In a statement issued Friday, the State Commissioner for Health, Dr. Amina Baloni, says that given the persistence of the COVID-19 virus, there is need for every resident in the state to assume utmost personal responsibility. According to her, these non-pharmaceutical measures can be safely and easily practiced to reduce the risk of infection, severe illness and fatalities, while places of worship, restaurants, shops, event centres, hotels are reminded to kindly patronize compliance with the public health guidelines. The statement also reads in part, Kaduna State has launched a campaign of mass vaccination to increase the number of citizens that have taken the approved COVID-19 vaccines, and already more than 450,000 residents have received at least one vaccine dose. But this number needs to grow to increase immunity levels and help reduce the risk of severe illness when infection occurs. Away from Nigeria, there's been more COVID-related flights cancellations globally as the week starts, disrupting holiday travel plans for thousands of people. A data tracking website says more than 1,400 flights have been scrapped today, with Chinese and U.S. destinations being the worst hit. U.S. airlines say the disruption is due to crews testing positive or isolating. Hong Kong is banning all South Korea's Korean Air flights for 2 weeks after positive cases among some arrivals. In all, more than 8,000 flights have been grounded over the long Christmas weekend that began on Friday. Well, let's look closely at the situation in England. Dr. Esen Ukurabi is the GP Registrar, Worcester Royal Hospital, and he joins us now virtually. Thank you for joining us on the program.
Thank you very much, Millicent.
All right. Many have looked forward to this year's holidays. I'm sure yourself as well, after so many plans were dashed last year as well. Give us a feel of what this year's Christmas looked like.
Well, I would say that there is a massive difference between where we are currently as a country and where we were last year. This time last year, families could not celebrate Christmas with themselves. and we were restricted from, meeting with loved ones and friends. This time last year, very few persons in England and in the United Kingdom were vaccinated. However, I think we are in a much better place at the moment, if we look at the situation of things regarding the pandemic. This year, families could spend Christmas with themselves and with their loved ones. I had the privilege of spending Christmas with my family, my extended family and friends. This year, lots of people in the UK have also been vaccinated. There were no restrictions as far as England is concerned in terms of movements with coronavirus. And so Christmas was a lot better, of course, compared to last year. However, in places like Scotland and Wales, some restrictions came into play on Boxing Day, but in England, we're still as we were previously.
Now, the question is, with the surge that, England is experiencing in recent weeks due to the Omicron variant, do you expect there will be new measures, new restrictions to curtail the spread?
I mean, it is true that Omicron is spreading rather quickly, not just in England, but of course in the entire world. And just last week, England recorded a new highest level of infections per day. Over 120,000 persons were infected. But of course, studies over the world as well have been consistent in the fact that the Omicron variant causes less severe illness, and of course the likelihood of being hospitalized is also reduced with the Omicron variant. As of today, the government have said that they have no intentions in England to introduce tougher restrictions. But of course, we can see the neighbors in Scotland and Wales, they have started to introduce some sort of restrictions. So nightclubs have been banned, large gatherings have been stopped, social distancing have also been reinstated, as we saw earlier on in the pandemic. So I think if we continue to see the cases of the Omicron variants continue to rise, yes, it doesn't cause hospitalization, but some would be hospitalized. So if we have lots of infections, there might become a point where the government in England might introduce some restrictions in terms of movement in order to curb the spread.
We also understand that health workers, have been working hard. Immunization campaign went on Christmas Day in the race to inoculate as many people as possible. But we also hear that there is the consideration of door-to-door vaccination teams being deployed to prevent further restriction. Has this started?
Well, I've always said that vaccination still remains a vital aspect of battling this pandemic and the coronavirus. And you rightly said that the health workers, the GPs, those in hospitals have been working to ensure that vaccines are rolled out. At the moment, all adults in the UK and everyone over the age of 16 with a risk factor is entitled to have a booster dose. That's the third dose of the COVID vaccine, and measures have been ramped up to ensure that this happens. And of course, even on Christmas Day, where people were meant to be enjoying, there were still vaccination centers opened and offering booster doses and of course vaccines to people who have not yet received their vaccines. And in the nearest future, if there are still people yet to be vaccinated, we might see a situation where it will be a door-to-door vaccine program being instated in the United Kingdom. I think the drive is to make sure that as much as possible, a large number of the population gets vaccinated. This way, people will of course not fall ill, and of course the pressure in hospital as well will be reduced.
Dr. Esin Okore, BGP Registrar, Worcester Royal Hospital, England. Always a pleasure having you join us on the program. Thank you and enjoy the rest of the holiday.
Thank you very much.
And indeed, according to reports, the British Prime Minister is due to be briefed on the latest COVID data as he weighs whether to impose additional measures in England before the new year. Well, after 2 days without published figures, Boris Johnson will hear the impact on the NHS of record infections in Scotland, Northern Ireland. They've tightened up for a second day with new restrictions for pubs as well as restaurants. Meanwhile, new COVID-19 vaccine restrictions have come into force in New York City as infections continue to surge, fueled by the Omicron variant of the virus. Children aged 12 and over are required to show proof of full vaccination to access indoor dining areas and many extracurricular school activities. The city is also introducing a vaccine mandate for private sector workers, the first in the U.S. to take such an action. Jabs are already mandatory for state employees. The measures were announced earlier this month by Mayor Bill de Blasio, who mentioned the threat posed by Omicron, which appears to be more contagious but milder than other variants. Cases of COVID-19 have soared in this city and across the country in recent weeks. And staying in the United States, the country is to lift travel restrictions it imposed on 8 southern African nations over the new coronavirus strain. The White House said the 29th of November measure affecting South Africa, Botswana, Zimbabwe, Mozambique, Namibia, Lesotho, Eswatini and Malawi would be lifted by New Year's Eve. The officials said the curbs were no longer necessary amid a U.S. explosion of cases of the Omicron variant, which now makes up most of all new U.S. cases. The restrictions were first imposed by the EU and UK. The U.S. and a host of other countries followed suit. An Israeli hospital administered 4th COVID-19 vaccine doses to a test group of health workers on Monday in what it called the first major study into whether a second round of boosters will help contend with the fast-spreading Omicron variant. According to a spokesperson, results of the trial, likely to be closely watched internationally, will be submitted to Israel's health ministry in about 2 weeks. Well, that's it on the program. You can visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy, celebrate responsibly.